So I'm Innocent Byiringiro, general surgery resident from Creighton University. I wanted to thank you, Cedric, for giving us opportunity for this presentation, and my mentor, Dr. Nandipati, who this would not have been possible without. And so our work is on the long-term survival outcomes associated with esophagectomy for robotically assisted minimally invasive esophagectomy for esophageal cancer, which here on will be referred as REMI. So all of the authors, we have no disclosures to make. So we looked at can I go back?
This button is backwards and that's forward.
Oh, there we are. Sorry about that. Looked at the National Cancer Database for the patient who underwent esophagectomy for either adenocarcinoma or squamous cell carcinoma, and we found about 14,000 after excluding those with unknown staging, metastatic disease at the time of diagnosis, or any other of the variables that were including our statistical modeling. If they were missing, we excluded them. We ended up with about 5,100 patients, about 400 underwent REMI, and MIE being about 1,000, and the remainder being open. And what we found was that the overall median survival for these patients is about 42 months. And when you factor the mortality status within the REMI group, the survival was about 62% versus 53% in the MIA, and a little bit less than 50% for the open. So it might be kind of hard to appreciate from maybe where you're sitting, but the Kaplan, the survival plot, the top line shows the REMI, which has a significant survival, the same as a significantly prolonged survival, the same as MIE, but these differences, they seem to disappear after 5, 6 years. And when we did multiple regression to identify factors independently associated with survival, the patients who underwent esophagectomy at an academic center versus community or comprehensive cancer, they had a better survival. And those who underwent REMI, or those who were female, or those who had income, a higher income versus lower income and neoadjuvant treatments. So in conclusion, REMI, those who underwent REMI and academic center had a decreased risk of mortality during this time frame that we analyzed. With that, we can take some questions.